Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we're going to look at the PDE inhibitors. So this PDE inhibitors, the first one is the non-selective PDE inhibitors. So the first variety will be the non-selective PDE inhibitors. So what happens in the non-selective PDE inhibitors? This includes the methylxanthines. So what are the drugs? Drugs includes the methylxanthines, methylated xanthines. So you include the methylated xanthines, then it also includes the caffeine. So methylated xanthines, the caffeine as well as the theophylline. So what are the clinical applications of this non-selective PDE inhibitors? So these drugs specifically they are used for the asthma and the COPD. So they are used in case of the asthma as well as the COPD. The next drug under this, the pentoxyphylline. So there is pentoxyphylline. So this drug pentoxyphylline is used. It is used in the PADs. The PAD is nothing but the peripheral artery disease. Next, moving on to the PDE2 inhibitors. So in case of the 2 inhibitors, there is a anagrelide. So this anagrelide is used in case of the essential thrombocytosis. So there is something known as the essential thrombocytosis. Next, there is the PDE3 inhibitors. So PDE3 inhibitors, the cilostazol. So there's something known as a cilostazol. The cilostazol is nothing but the PAD, that is a peripheral artery disease. Then comes another drug, drugs such as the milrinone and the amrinone, as well as the amrinone. So milrinone and amrinone are mainly used in case of the cardiac failure. Next, we look at the PDE4 inhibitors. So this PDE4 inhibitors such as the roflumilast. So there's something known as roflumilast. So roflumilast as well as the drotaverine. So there is something known as a drotaverine. So this roflumilast is used in case of the COPD. So there's a no COPD. The next is in case of the drotaverine. So in case of drotaverine, the drugs it is used in case of the as antispasmodic drug. Spasmodic drug. Next, we move on to the PDE5 inhibitors. So this was about the PDE4 inhibitors. Lastly, moving on to the PDE5 inhibitors. So this 5 inhibitor, it includes a sildenafil, so there is sildenafil. Next, there is also the vardenafil. So there's sildenafil, there's vardenafil, there's tadalafil. So all this also inhibits the PDE6. So what are the drugs used in case of the PDE inhibitors? So the use is, they are used in case of the ED, that is erectile dysfunction, as well as the pulmonary hypertension. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.